Africa crossing. I think we check that right now. Is that correct? Yes, there is. We check to that right now.
Guidelines for the serology testing on the continent and many other aspects that we have. Again, the task force that I presented is a continental task force endorsed at the highest level of the continent. So we are all part of that continental structure, which was launched on February 22nd with the presence of Dr. Moeti and Dr. Tedros calling from Geneva for the first hour of that meeting. So we are coordinating and linking up as much as possible.
Thank you. This is a question, a most upvoted question from Louise Hart. Is there any evidence so far that the trajectory of the outbreak in countries in Africa is differing from the way it has developed elsewhere in the world? And I think you can both probably have something to say about that. So
maybe
David,
I'll start. Maybe I'll start, John.
Yeah.
I think that as John said, this is it's relatively new in Africa, the outbreaks. They didn't come in as they came into Europe early in January, February. And so now it's coming in and they're beginning to understand. And interestingly, in South Africa, they've shown that it's come in from Europe and not from Asia. So I think it's beginning to enter into Africa from many different places. And Africa is now setting up the mechanisms to really deal with it. So that's the first thing that I wanted to say about this, is that it really is young. And Africa's beginning to respond the way it is, and it's coming from many different directions at the same time. What's the next part of the question, Emma?
It's whether the trajectory of the disease in Africa is behaving. Is it going the same way as it has anywhere else, or any evidence that it's different from the way it's elsewhere?
Yeah. I'll just speak from what I know about discussions at WHO with various countries. The trajectory in South Africa could have been just like in European countries. It began, but they rapidly went out to their health facilities. And as John said, the local response is what's really effective in many places, including Africa. They went out and they strengthened the capacity in their primary healthcare facilities. And then they saw the outbreaks shift from a European population that had been brought in and the populations in the major cities to areas in rural South Africa, but they were able to contain those outbreaks as they were occurring. So the trajectory, at least in South Africa, was the same. And I think that's why John can speak better, but that's why I think this test, trace, treat strategy is going on now in order to prevent this the same way that South Africa's prevented it from taking off in that part of the world. So back to John, I guess, for his observations.
No, I mean, David, you're absolutely right. And this is, again, not an area of speculation, but we're back with data, because when countries went into lockdown very early on in March, it was interesting that when we left Addis Ababa and agreed to develop a joint continental strategy on February 22nd, only Egypt had reported a case. And when they left, and by the end of the month, exactly, I think 29 or 28 of February, and Nigeria started reported cases, and then subsequently, the first week of March, I would say, I use this very deliberately, the continent tip, because so many countries reported cases from Europe that are coming in there. But then they did something extraordinary. The countries were locking down where they had 2 cases or 3 cases. Some countries went to states of emergency where they had no cases. And so that helped to blunt that. We have data that shows that South Africa, for example, was seeing a daily increase in number of cases, about 30 to 40%. And with the lockdown after 2 weeks or 3 weeks, it had decreased to about 5% increase on daily basis. So we have enough data to support that helped to blunt the outbreak. Otherwise, we would be in a very, very different situation. Now, the challenge we have is, as countries are unlocking themselves, we have to provide guidance, and which we've just developed guidance for unlocking our economies, and which is really a balance between saving lives and saving livelihoods. And we'll see, of course, in the next coming weeks, what that will look like, because as we unlock a system, there will be, it's clear that we'll see an increase in number of cases. But the key question will be, are we doing the test, trace, and treat strategy in an enhanced way? And also, we use the time that, the borrowed time that we had to increase our healthcare facilities to receive more patients? Have we learned some new lessons that we can apply there? So I think I don't know many of those answers. As David said, we are dealing with a new virus. We are learning every day, and we are trying to understand our pandemic as much as possible.
This is another one for you, John, I think, from William Crawley at the BBC. Is the disproportionate risk of infection reported among BAME communities in UK and USA specific to those countries, or is it reflected in the African statistics as well?
To be quite honest with you, we have not done a continent-wide analysis. And again, as I said at the start of this, the continent itself is so diverse. And that's why I took time off to go region by region, and we see them. It's very misleading to dump numbers on the continent. It will give you a very different picture. So that analysis is beginning to happen. It couldn't have happened earlier because the confirmed death number rate was low. Excuse me. And as we move with this large number, countries are beginning to do their own analysis, like South Africa, to understand what are the groups that are most vulnerable and what are the underlying factors that are driving mortality. And again, it's too early, but some of the initial trend shows that people with existing diabetes, hypertension, have seen a higher mortality amongst them, as well as HIV. I think that, as we would have expected, that is, but again, it's very early. We still have to pull this data together, work through as a task force, continental task force, to analyze and understand this data a little bit more.
Thank you. Here's a question that we've kind of covered. This is about from Yasser Abdul. It's an upvoted question. What would you say Africa is doing well that European countries and others could learn from, and vice versa? We've discussed the regional approach seems to be quite this unifying approach. But David, why don't we start with you of what you've observed Africa doing that European countries could learn from?
Well, I think that, everybody, thanks, Emma. I think everybody is striving to equalize the risk and equalize the response capacity so that international travel and trade can begin again. In other words, countries with the same risk and with the same capacity to respond will be those countries that can be fairly well assured that if they open up their travel and trade, they will have the ability to they will not see an increase in cases in their countries. That requires a good disease detection system. And that's where Africa may have difficulty at present, but they're strengthening this capacity to detect this. And certainly in capital cities, they'll be able to detect where there are cases that are occurring so they can rapidly respond. Where Africa has in place a system to respond is much better than in some European and other countries. This test, trace, and treat mechanism, which is vital to being sure that there is a response capacity so that when risks are equal, the response can be occurring if necessary. And so I think Africa will be possibly ahead of many countries in having this ability. They already have it from outbreaks of Ebola, outbreaks of meningitis, whatever they have to deal with, they already know how to do this. Contact tracing, test, trace, and treat. So they're way ahead in that. They may not be ahead in disease detection systems, but I know that they are working under the African Union, under WHO, to make sure that those systems are in place and can be reporting when there are diseases that might be COVID, for example. So that would be my views, Emma, and I'd turn it over to John now for his views on this.
I think, David, there are two components to this. We had the great fortune of seeing what was going on in China, Europe, and the United States, and use that to to argue for a strong, coordinated continental approach. I think, which again it was exceptional that within a week of the first case being reported in Egypt, the continent came together, and that continental mechanism still exists. Every week on Mondays, the ministers from the different regions all come together, about 15 or 20 of them, and we discuss this together for about 2 hours. I think that is a very good thing, and I've said that you also have ministers of finance coordinating and transport, and that all fits into the Bureau of the head of state, chaired by President Ramaphosa, and with a strong coordination of Chairperson Moussa Faki. So I think that is good. There's a difference between knowing what to do and having the ability to implement what you know what to do. I think that is clear. If our pandemic goes out of hand, it's not because we don't know what to do. It's just that we are limited with capacity to implement what we know to do. And I must say very personally that to me is very. It stresses me more than anything else. I think that that if you see the challenge we had in getting diagnostics. Okay, in saying supporting Chikwe or supporting Amadou Sarr or supported Victor Mukonka in Zambia to get access to tests. I mean, you called and said, John, we have 5 swabs, okay, to do the testing. This was very early on. And then what do you do? So I'm scratching my head, looking across the whole world to find additional swabs to send to Zambia. So you ask yourself the question, if we have those, we knew what to do, and if we had those commodities to respond, where would we be? Okay, so I think that is something we must factor into the discussion when we think we do an after-action review of how our response was. I mean, I really will hope that it should be central stage in the discussion, and how do we fix those gaps? What I call the known do-nothing gaps. And on the continent, some of that is on the continent itself. We have to evolve from a continent that says we must manufacture certain things, like diagnostics. We have to have platforms that can manufacture diagnostics on the continent, such that you don't rely completely from external supplies for diagnostics that you could. I mean, I'm happy that the Senegal group is developing that. Morocco is developing something. I believe South Africa and Kenya are doing that. And we are at the center as Africa CDC, helping to coordinate that manufacturing process and evaluation process there. So, yeah, I would say that, I mean, there's those gaps that existed, which there's a lesson for Africa to learn early on, and hopefully that the world is learning something from Africa.
Following on from that, actually, and I think you partially answered this, 2 questions from John McDermott from The Economist. And the first one was, what needs to be done to get tests to Africa? What are the precise bottlenecks? You've discussed manufacturing capacity and the reliance on importing, but is there anything else that is specific, a precise bottleneck in testing capacity? And the second question is, is the CDC doing anything to try to measure excess mortality rates, which are viewed as the gold standard way of measuring the impact of COVID-19? Many countries don't have cause of death data, but is it possible to do samples in hotspots? So if you want to answer the bottleneck in testing first, maybe.
Yeah, the bottlenecks in testing, as I indicated when in my presentation, it was it continues to be a challenge, but something that we should look at the trajectory we are heading to. Just about a few weeks ago, really weeks. I mean, the continent was testing had tested less than 400,000 tests, and now today we are about 2.4 million tests, and the curve is in the right direction. I think when we fix and we address issues, we don't expect that the solutions will address those overnight. So I think we are very encouraged to see the direction we are heading with the testing. And built to that is the ability to trace. I think the testing alone, this is not a malaria test or an HIV test. It's testing for a virus that is spreading quickly. It's testing for COVID that we know that we have to have the results in a timely manner and then do all the needful. I think that is key. We are unlocking that as we go and learning from it as much as possible. So the second question on excess mortality is that, I mean, we, as CDC, we have to rely on member states to do that. And we are encouraging that those surveillance systems should be put in place for countries to generate such data, because that would be extremely valuable for us to know our pandemic. As I said earlier, there's an effective response will only be guided by good science and good data.
Thank you. Did we do? Yes. So let's take two questions together. First one for David from Caroline Johns on vaccines. This is most upvoted at the moment. Please, could you comment on the recent reports that people who've had the BCG vaccination may be protected somewhat against COVID-19? And Judith McGregor, is there any information about which groups and population in different countries are proving most vulnerable to contracting the virus and most likely to succumb to it? Are the patterns emerging similar in Africa and in other parts of the world? So,
so
I guess go ahead.
The BCG vaccine piece, I would say very briefly that we don't have any data on that. I mean, we don't have any evidence, but as we are learning, it's a new virus, we're learning. I'm sure that with time, the data that will emerge will help us address that, but we just don't have anything to stand on to make any conclusions on that. With respect, excuse me, with respect to the different patterns, excuse me, I said, as I indicated earlier, we're doing an analysis and we are seeing that, of course, early on, I mean, in this, we are very early on, that I begin to see some of the risks for mortality being very similar to what we saw in Europe, North America, and Asia, which is diseases, underlying diseases like diabetes, hypertension, and some of the very early data is beginning to emerge on HIV. Will be factors that will accelerate. But in terms of vulnerable populations as a whole, we expect that this virus, when it seeds itself into very vulnerable populations, like the slums around big cities, it can be devastating. And I think we have to be extremely worried collectively about such a possibility.
David,
or refugee camps, for example, are also areas that and the migrant populations are those that we should all be worried about.
David, do you have any thoughts or anything you're hearing from the WHO level on the BCG? This has come up a few times.
Yeah, John has already answered the question. I would say that BCG has been considered as being useful perhaps because it stimulates the immune system. And it's used, as many people know, to treat cancers. For example, cancer of the bladder is treated with BCG because the BCG stimulates the immune system to get rid of the cancer cells in the bladder. So there are some examples of where BCG vaccine does stimulate the immune system. But the BCG vaccine has been touted as possibly the reason that Africa hasn't seen outbreaks. But I think John's arguments are much more convincing that it's just early in the stage of the entry of the virus into the African continent. And there will, of course, be a look to see whether or not BCG, which is given to all children in Africa very young in birth many times, which is given to children to see if it has any protective effect. But it's probably unlikely at present that it will show any effect. Although, you know, it's a good hypothesis. And as John says, what we need to do is collect evidence. And when we have the evidence, then we can say yes or no. So it's the jury is still out on BCG, but I think most experts think that it may not be an effective way of preventing infections.
I wanted to pick up on the comment John made on refugees. There's actually a question on that from John Tasker from CBC. Cabo Delgado in Mozambique is a hotspot for COVID-19, and the population is on the move to escape from terrorist attacks. It appears movement of refugees may be spreading the virus into towns and cities. How much of a risk does CDC consider this is?
So there's a whole department within the Commission of the African Union Commission called the Department of Social Affairs that deals with issues like immigration, refugees, and they work very closely with the Peace and Security Council of the African Union to address those issues. But we as the CDC have not taken a lead on that yet, just because of the limited capacity to have. But we are advising countries very strongly that those populations should be really taken very seriously. And several meetings have been held, and have addressed several countries with respect to what approach they should be taking in those populations, which is essentially a community-led effort, which the solutions in terms of prevention have to come from the community, which means we have to build trust with those communities. We have to create community leaders that will own that process and actually know exactly how to interact with their various communities.
Thank you. We're running out of time. I'll do two more questions. One is, this is the most upvoted question at the moment from Andrew Sakala. What measures have been put in place to ensure that the funds the governments are putting into place are used for the intended purpose? And another one from Osman Dar. Ghana has pioneered pooled testing of samples and explains why they have relatively high testing statistics. What is the ACDC position on this? Because if done well, it has the potential to significantly ramp up testing capacity across the continent.
So if you don't mind, you just repeat the first question. The
first question is, what measures have been put in place to ensure that the funds that the governments are putting in place for the response are used for the intended purpose? I guess, the financing controls. And that's the first question. And the second question was about pooled testing of samples.
So So with respect to the first question, the African Union has actually put together an African Union COVID response fund with a very strong board that includes the private sector and the public sector. They're really a group of well-respected Africans that are managing the fund. So countries are pledging. There is also another aspect that the continent has done very, very, very well. And pledges have come in, and we really are excited with that innovation. At the country level, as you know, this is a pandemic that is very different from Ebola. During the Ebola outbreak, we were able, as African Union, to have a common fund for everybody. But as we know, many countries that have developed a fund for the locally, which enables the private sector within the country to contribute. As to the transparency and governance of those funds, we can only expect that everyone knows that this is a serious health threat. Everyone knows that this is a serious economic threat and actually a security threat for our continent, and that those funds will be directed to address the most appropriate needs. I always say that my analogy, the crude analogy of the COVID-19 is that your kitchen tap sink is leaking and the tap is flowing and water is on the floor. In order to get a dry kitchen, you have to lock that tap off. And all efforts should be done to use the monies that are raised to close that tap so that we can at least now clean the floor and bring the kitchen back to normal. I think, again, I expect that there will be a good transparency and to use the funds that are generated appropriately. With respect to pool testing in Ghana, it's a known...
Sorry, a quick one, because we've run over time and David is chairing another webinar right now. But generally, good idea, bad idea, pool testing?
good idea.
Great. Thank you. I'm sorry I had to rush you at the end of that. But thank you both for joining us, and a great discussion. And for everybody else, the recording of this, in case you came in late, is on the website. And next week, David and I will be talking with WHO Disease Detective Oliver Morgan all about contact tracing. So thank you all again, and I'm sorry we ran over. Brilliant to have you. Thank you.
Thanks very much, John, and thanks.
Thank you so much for inviting Africa CDC to be part of this.